Okay, fine. So we can start today's session. And yes, I'm sorry for taking the session so late, but I was just preparing the matter, so it took some time. And before I start, I'll just want to make couple of requests. Number one, I'll request all of you to, add into that Telegram group so that the communication is much better, because as my preparation for the session is over, then only I'll come live, and before that I'll drop a message in the Telegram group, right? So just make sure that you are into that Telegram group so that you get timely notifications about the sessions. And number two, all these annotated PDFs I'll upload in my app, right? So just make sure that you revise all these annotated PDFs, because I'm adding some images also that you can review later, right? So with this word we can start today's session. And again, the question type is mixed, some from FMG which are pretty easier, some from NEET-PG which are little difficult. So that is how the paper has been set for today's session. So starting with the very first question, a patient with infective endocarditis has blood cultures growing gram positive cocci in clusters, right? Then the isolate is catalase positive, coagulase negative, and resistant to novo biosine. So this is what has been given in the question, and then you have to mark the bacterium which is responsible for this clinical presentation. So let us take the keywords first. So the patient is a known case of infective endocarditis. Okay. Then the blood cultures was done, and it shows that the organism is gram positive cocci, right? So gram positive cocci. Now we know that cocci means rounded forms. Okay, so rounded form. Now when we say rounded form, again we have two type of cocci. One is staphylococci. Okay, so one is staphylococci, and the second one is streptococci. Clear? So it can be staphylococci or it can be streptococci. Now how to differentiate whether it is staphylococcus or streptococcus? We go for catalase, and so we will go for catalase here, right? So this will help us whether it is staphylococci. So this is catalase positive, this is catalase negative. So we can rule out one thing, that okay, this is not streptococcus. This is one thing, right? So here we can say that this is not streptococcus. Now we have to search in terms of staphylococci, but looking at the options, A is also staphylococcus, B is also staphylococcus, C is also staphylococcus. Now how to differentiate amongst these three? So what we will do now, we will take the help of coagulase, right? So we will go for coagulase, and if it is coagulase positive, it can be coagulase negative. So if it is coagulase positive, this is staphylococcus aureus. Clear? So if it is coagulase positive, this is staphylococcus aureus. So now here in the question, this is coagulase negative. So we can also exclude this one. So catalase positive, streptococci eliminated, because this is catalase negative. Okay. Then coagulase positive, this is, so the question is coagulase negative, so we can exclude staphylococcus aureus also. Now we are left with two options, Staphylococcus saprophyticus and Staphylococcus epidermidis. So what we will do, we will take the help of novo biosine, right? So, novobiocin. Now, whether the bacterium is sensitive or resistant. So, it can be resistant or it can be sensitive. Now, if it is sensitive, this is epidermidis. Okay. So, this is epidermidis, and if it is resistant, this is saprophyticus. Clear? So, in the question it is resistant to novobiocin. So, our answer will come out to be Staphylococcus saprophyticus, right. So, this is how we need to go with these kind of questions, and these are pretty common in exam. So, most of the time they will give you some reactions or sensitivity to some antibiotic, and then you have to follow the entire flow chart, and then only you can reach up to the answer. So, catalase positive Staphylococcus, coagulase negative, it means either epidermidis or saprophyticus, and resistant to novobiocin, it means it is saprophyticus, right. So, this is how you will reach up to your answer. So, please read this thing properly. So, you can take this chart, something like this. Okay. So, you can just read it in the annotated PDF, which I will be uploading on my app, right. So, for the time being, the answer is saprophyticus. Clear? Chalo, moving forward to next question. Now, this is one question which has been repeated over the years, and again the case history starts with a diabetic patient who is having black nasal discharge. So, the moment you have these two keywords, I think most of you can answer it what the condition is. So, diabetic with black nasal discharge. Now, he is having facial pain and orbital swallowing, there is ketoacidosis, and then histology is showing broad aseptate hyphae which are branching at right angles. So, I think all of you can answer this. So, very good Aditya, very good Priya, yes, both of you are right. So, known case of diabetes mellitus presenting with black nasal discharge with orbital swelling. Yes, the diagnosis is mucormycosis. Okay, and what we see in histopathology is showing us broad aseptate hyphae and branching at right angles. Clear? So, this is all classical for Rhizopus aerugis, right. So, this is how you can remember it. So, very common questions. Yes, everyone is right. Now, moving forward to next question. Now, here the question is about a neonate who is having meningitis, right. So, a neonate having meningitis, then the CSF culture is showing gram positive bacilli which is showing tumbling motility and beta hemolysis. Okay. So, neonate with meningitis, then gram positive bacilli, okay. So, rod form and tumbling motility, then beta hemolysis. Very good Priya, very good. The moment you have this word meningitis in a neonate, then tumbling motility, I think most of you can answer based on this fact only that yes, this is Listeria monocytogenes. So, this is a case of listerial meningitis. Okay, so this is a case of listerial meningitis. Bacilli, this is of rod form. Now, the question is, which virulence factor allows for intracellular spread? So, the question is about virulence factor which is allowing intracellular spread. Now, I think the answer is pretty obvious. If you know this word, you can simply mark the answer as listeriolysin O, right. So, that is not much difficult, but the keyword here is tumbling, motility and meningitis in a neonate. So, that is how you can answer this question. So, very easy. Then this image you can see in annotated PDF. Now, some questions you can at times solve by the principle of exclusion. So, maybe you do not know the exact answer, but if you just skip the other options, maybe you can reach up to the most probable answer, right. So, here there is a patient who is having meningococcemia. Now, which lab test rapidly confirms the diagnosis in CSF even before the culture? So, here there is a case of meningococcemia, okay, and then CSF test which will help us in diagnosing even before going for blood culture. So, if you exclude the options, I think you can reach up to the answer. Now, here this is classically for meningococcus, and meningococcus is what? This is Neisseria meningitidis. Clear? So, this is what is Neisseria meningitidis. So, we have to choose one option which correlates with Neisseria meningitidis. Obviously, we can exclude India ink preparation because that is for Cryptococcus, right. So, this is for Cryptococcus. So, option A can be excluded. Then suppose we do not know anything about B, so we can exclude it. KH mount, it is for fungi, so we can exclude this one also because Neisseria meningitidis is not a fungi. Then dark ground microscopy, this is especially for spirochetes like Treponema pallidum, which is for syphilis. Clear? So, we can exclude this one also. So, we are left with only one option, that is lattice agglutination test. So, this is how at times you can just exclude the other options, and even if you can exclude two, I think you have all possibility of marking the answer right, and that is how you should approach the paper of NEET-PG. If you can exclude two, then only try attempting that particular MCQ, right. So, at least two has to be eliminated, and then you can try your luck between the remaining two. Then this is one more easy question from a very favorite topic, like a laboratory receives throat swabs from a child suspected of diphtheria. Now, which culture medium is most appropriate for isolation of the offending bacterium? So, I think yes, everyone can mark, like this is diphtheria. So, this is Corynebacterium diphtheria, and I think everyone will answer it, Lofrum serum slope followed by potassium tellurite agar. So, that is very obvious, right. So, the answer has to be C here. Very good, Gaurav, Priya, absolutely right, bacho. So, LJ, this is for Mycobacterium, tubercle bacilli. Seborrhoea, this is for fungi. SDA, right? So this is SDA. So this is very classical question, asked many number of times. Then moving forward to a very good question, a hospitalized patient, right? So patient is hospitalized, then he develops ventilator associated pneumonia, right? Hospitalized patient developing ventilator associated pneumonia. Culture is showing a non-lactose fermenting gram negative bacillus which is producing blue green pigment and fruity odor. Which bacterium is being discussed? So let us take the keywords. Hospitalized patient. So we can think of nosocomial infection here. Clear? So it's most likely nosocomial, and the classical word is ventilator associated pneumonia. So ventilator associated pneumonia. Then it is non-lactose fermenting gram negative bacilli, but more importantly the classical keyword is blue green pigment, and lastly fruity or grape like smell. So these are all keywords. Very good Gaurav, very good Priya. Yes, this is classical for Pseudomonas aeruginosa, right? So blue green, this is pyocyanin, right? Sometimes there is yellow green pyoverdin, right? So that's pyoviridin. So what does it mean? That it's a pigment producing bacteria. So it's a pigment producing bacteria. Clear? And fruity or grape like smell. So that's all classical description of Pseudomonas aeruginosa. Very good Gaurav, very good Priya. So please remember this, very important and very favorite for exam setters, Pseudomonas aeruginosa. Then moving forward to next question, again from a very important topic. So a patient is presenting with prolonged fever. So there is prolonged fever and blood culture, it showed Salmonella typhi. Okay, so probably this is a case of typhoid or enteric fever. Now, which serological marker appears earliest during infection? Right. So, clinical presentation of prolonged fever and blood culture Salmonella typhi. Yes, the clinical diagnosis is typhoid or the enteric fever. Now the question is about which antibody or serological marker appears first. So here you have to remember three. One is obviously O antibody, then second is H antibody, and the third one is VI antibody, right? So there are three, and what you need to remember, O is earliest, H is later, and VI is for carrier. Clear? So O earliest, H later, and VI for carrier. So your answer will come out to be O antibody. So please study salmonella properly. It's very important, especially with respect to typhoid, of course. Chalo, moving forward to next question, and again HIV based questions, always they come in exam. So a 32-year-old HIV positive male presents with headache, fever, neck stiffness. So obviously this relates to meningitis. Now CSF India Inc. preparation, it reveals, so this is in CSF. So CSF India Inc. preparation reveals an encapsulated budding yeast. So I think the diagnosis is pretty clear to all of you. So it's a known case of HIV with signs of meningitis in the form of headache, fever, neck stiffness, right? And then India Inc. preparation of CSF, it is showing encapsulated, means with a capsule, budding yeast. Clear? So the diagnosis is cryptococcal meningitis. So it's a case of cryptococcal meningitis. That's pretty obvious. Now the question is about the virulence factor which is primarily responsible for its pathogenicity. So Gaurav, very good bache, this is polysaccharide capsule, right? So we have already written that it is encapsulated. So it is the polysaccharide capsule which is responsible for virulence of this particular fungus. Clear? So this cryptococcal meningitis, and again it is very important, just try to read it in detail as much as possible, cryptococcus or cryptococcal meningitis particularly. Then moving forward to next question, a patient develops acute flaccid paralysis after consuming improperly canned food. Which mechanism explains the action of responsible toxin? Now I think most of you can yes, so there is a history of ingestion of improperly canned food, and after that the patient has acute flaccid paralysis. So I think most of you can make the diagnosis. This is a classical case of botulism, right? So that's, I think everyone will can mark that. Now the question is about the mechanism of action of the toxin. So how the botulinum toxin is acting. Yes, very good Gaurav, absolutely right bache. So what happens, like suppose if this is the presynaptic and this is the postsynaptic end, then obviously there are acetylcholine receptors, then there are presynaptic vesicles which are having the neurotransmitter acetylcholine. Now what happens, the botulinum toxin, it impairs binding of these vesicles to the presynaptic membrane, and therefore there is no release of acetylcholine in the synaptic cleft. So there is inhibition of release of acetylcholine. So that's the basic mechanism, and there is damage to the snare proteins which are actually responsible for binding of these vesicles to the synaptic presynaptic knob membrane. Clear? So that's very basic, and one question which has been asked many number of times. So botulinum toxin mechanism of action inhibits release of acetylcholine at the synapse. Moving forward to next question. A microbiologist performs a modified acid fast stain on sputum, right? So modified acid fast staining on sputum. Then there is red colored branching filamentous organisms are observed. Now which organism is more likely? Priya, Gaurav, absolutely right, absolutely right. So this is modified AFP, right? And then what is being seen? Red colored, but importantly branching and filamentous organism. Clear? So the moment you have this kind of description, this is not Mycobacterium, this is Nocardia asteroids. Very good, Priya, very good, Gaurav. So just remember this keyword, branching and filamentous, and this will differentiate it from Mycobacterium tuberculosis, because what usually happens, the moment students see AFB sputum, directly they jump on to Mycobacterium tuberculosis. So please don't do that. Consider this point as well. So branching, filamentous organism, the answer has to be Nocardia. Very good, Priya, very good, Gaurav. So now moving forward to next question. A pregnant woman develops primary genital herpes near term. Now the question is about which property of the virus explains its lifelong persistence. So the condition is like she is having genital herpes, but the question is about how this virus is surviving, is staying in the body for a long period of time, and yes, it remains dormant or latent in sensory ganglia, right? So latency in sensory ganglia. Very good, Priya, very good, Gaurav. Okay, so latency in sensory ganglia. So next, again a very good question, and I think most of you must be able to answer this as well. A case of recurrent peptic ulcer disease undergoes rapid urease test which came out to be positive. So the organism is surviving with the help of which enzyme? So the enzyme which helps the organism survive is by which mechanism? So I think the moment you have a case of recurrent peptic ulcer, yes, the very first is Helicobacter pylori, and this is confirmed with the rapid urease test. Now the question is that how this organism is surviving in acidic environment of stomach. So very good, very good. So what it does, it neutralizes the gastric acid, and this neutralization is done with the help of an enzyme, and that enzyme is urease. Clear? So urease, it converts urea to ammonia, and this helps in neutralizing acidity or acidic environment. Okay. So this is very important. There is formation of ammonia, and this neutralizes the acidic environment, and that's how Helicobacter pylori can survive in such a highly acidic environment, right? So this is because of this particular urease enzyme. Yes, so it is neutralizing gastric acid. Then moving forward to next question, following a dog bite, now this is just a very basic question, a patient receives rabies immunoglobulin and also rabies vaccine. Now, how this vaccine is producing immunity? I think so following dog bite, and I think most of you must be remembering category 3 of dog bite, where there is scratches, bleeding, especially with a stray dog, right? So here we take it as category 3, and in category 3 we have to do 3 things. First is obviously cleaning of the wound, then second is rabies immunoglobulin, and then third is anti-rabies vaccine. Now the question is, what is the mechanism of action of inducing immunity by this anti-rabies vaccine? Yes, I think it's pretty easy, and yes, if you will take your time, you will definitely answer this nicely. Immunoglobulin is always a passive, and this is always active. Clear? So I think this is pretty clear. So vaccine is by active mechanism, immunoglobulin are ready-made antibodies, so that's a passive. So yes, very good, Priya. So this is how you can solve this basic question. Now next question, a child presents with fever, strawberry tongue, circummolar pallor, and diffuse rash. So firstly you have to identify the condition. So a child is having fever, then strawberry tongue, then circumoral around the mouth, so circumoral pallor and diffuse rash. So what is this condition? This condition is scarlet fever. Okay, so the moment you find this particular keyword, strawberry tongue and rashes, think of scarlet fever. Now scarlet fever is caused by streptococcus, and this is, yes Priya, very good bache. So this is pyrogenic exotoxin, which is also sometimes known as super antigen. Clear? So this is pyrogenic exotoxin or super antigen. So this is a classical presentation of scarlet fever. Now next question, a patient develops pneumonia after exposure to contaminated air conditioning systems. Now which medium is used for isolation of the organism? So here patient is a known case of pneumonia, and this is especially after exposure to contaminated air conditioning systems. So now what is the diagnosis here? So yes, this is actually Legionnaire's disease, and I think most of you will understand that it is caused by Legionella. And for Legionella, the medium which is used is BCYE. So buffered, charcoal, yeast, extract agar. Clear? So this is how you can solve this question, and the classical keyword is contaminated air conditioning system. So that will cause Legionnaires disease caused by Legionella, and the medium preferred is buffered charcoal yeast extract agar. Right? So this is how you should solve this. Now, hepatitis B markers always and always give you questions. So please be perfect with the markers, their interpretation, and this is one scoring area in the paper. So here a patient is having hepatitis B surface antigen positivity more than 6 months. Now, which marker indicates active viral replication? So I think it's a very basic question, most of you must be knowing. So hepatitis B surface antigen more than 6 months. So yes, it goes in favor of chronic hepatitis. And if we have to discuss in terms of active viral replication, yes, we go for hepatitis B envelope antigen. Clear? So we will go for hepatitis B envelope antigen, right? So the answer is hepatitis B envelope antigen. Very good, Gaurav. Very good, Priya Bache. So this shows that the virus is actively and rapidly multiplying within the body, and therefore the patient is highly infectious. So the patient is highly infectious. So that's the interpretation of this. Very good, Gaurav. Very good, Priya. Okay, so this is envelope antigen. The next question, a patient with fever, thrombocytopenia, has peripheral blood smear showing ring forms inside RBCs, and banana shaped gametocytes are also seen. So I think the moment you have this classical keywords, the answer is pretty easy. So a case presenting with, so there is fever, thrombocytopenia, that is reduced platelets, clear, and peripheral blood film is showing ring forms within RBC. This is one thing, but the classical clue given here is banana shaped gametocyte. Clear? So the moment you find this word banana shaped, I think yes, Priya, Gaurav, very good bachcho, Plasmodium falciparum, right? So this question has been asked many number of times. Please read nicely about Plasmodium falciparum. So this is how you can see the banana shaped gametocyte. Next question, again repeated many times in FMG especially. A renal transplant recipient developed cytomegalovirus retinitis. Which viral inclusion body is classically seen? So I think post renal transplantation, so high chances of cytomegalovirus retinitis, and the classical, yes, Priya, very good bache, Gaurav, very good, this is All's eye inclusion. Clear? So this is All's eye inclusion. Okay. Chalo. Next question, which vaccine is contraindicated in severe immunodeficiency state? So severe immunodeficiency. I think most of you must be knowing this. In very good, Gaurav, very good. When there is deficient immunity, never give live vaccines. So never give live vaccines, so it means they are contraindicated. Now why this concept? Because whenever we are giving live vaccines, we are actually giving live attenuated organism. Right? So what we are actually giving? Live attenuated. Attenuated means weakened. Now weakened in the sense that there are two terms. One is antigenicity and second is, you can say, pathogenicity. So when we say attenuated or weakened, the pathogenicity is nil but antigenicity is preserved, and when there is antigenicity, it will induce formation of antibodies. So this is what is meant by the live attenuated vaccines, that they don't have any possibility of causing infection, but yes, they will generate immune response. But what happens when the immunity is already gone? Even this much amount of organism is sufficient to cause infection, right? So that's why in immunodeficient state, don't give any live vaccine. Classical example is oral polio vaccine in this case. Clear? So here, even though the organism is weak, but it is, since the immunity is not there in the body, so even that much weakened status of the organism is sufficient to cause infection. So don't give live vaccines in an immunodeficient person. Then moving forward to the last question of today's session, a patient presents with severe muscle rigidity after stepping on a rusty nail. So I think you can understand what condition we are discussing here. So stepping on a rusty nail, and then after there is severe muscle rigidity. So what condition is this? I think everyone can answer. This is a case of tetanus. Okay, so this is a case of tetanus. Now the question is about how the toxin is reaching up to CNS. So here the mechanism is very unique. It is retrograde axonal transport. So especially the tetanus spasmin, it undergoes retrograde axonal transport. So very unique mechanism, right? So this is tetanus spasmin retrograde axonal transport in tetanus. So with this we end today's session, and very shortly I'll come up with one more subject, and again just those two. Yes, Kakul, very good bache, tetanus. So just those two requests. Please join the Telegram group, and please search it something like this, or if you have any problem, just drop me a WhatsApp message. I'll give you the link. And secondly, do download the app and revise all these annotated PDFs, right? So with this word, I say a big thank to all of you for joining me so late, and I'm very sure you must have enjoyed the session. So keep on studying. God bless. Good night. Bye bye.